Hey guys, today we're going to talk about Mlf syndrome. This is definitely one of those topics where medical students tend to memorize. And the problem with that is you might not get the straightforward question you're looking for on USMLE Step 1. They can twist and turn these questions into something you never heard of. And if you don't have a good background on this disease or similar neuroanatomy questions, you're not really going to get those easy points. So I suggest you draw whatever I'm drawing and explain it to yourself or your colleagues so you can have a better understanding on this topic. Okay, so in order for the eyes to move, they need to send signals to the brain and then receive signals back. And this is a pathway. The signal is going to go through optic nerve, which is cranial nerve 2, to the LGN of the thalamus, LGN stands for lateral geniculate nucleus. Okay, from there they're going to travel to the pulvinar nucleus, which is also a nucleus in the thalamus, and this is where the information is going to get processed in the pulvinar. And then from pulvinar, these informations are sent to the cortex, where then signals are sent to the motor neurons, and then we have movement. Okay, and the motor neurons that work specifically on the eyes are cranial nerve 3, 4, and 6. So now let's just assume that our patient is trying to look to the right. Okay, he heard a sound or something. Okay, he's trying to look to the right, and this is patient left eye, this is the patient's right eye. So in order for both eyes to move into the right direction, to this direction, we're going to use two different group of muscles. Okay, we're going to use the lateral rectus of the right eye and the medial rectus of the left eye. Now the thing here is that both these muscles are innervated by different cranial nerves. Lateral rectus is innervated by cranial nerve 6 and medial rectus is innervated by cranial nerve 3. Okay, so how are we going to get both eyes to look in the same direction? This is how it happens. The signals that are sent to the motor neurons, they're going to travel, okay, and they're going to go to the right cranial nerve 6 nucleus. Okay, they're going to travel here. From here, we're going to send signals through cranial nerve 6 to our lateral rectus muscle, which is going to cause contraction of lateral rectus. So this eye is going to look to the right. Now what about medial rectus of the left eye? So this is where Mlf syndrome comes into play, because the right cranial nerve 6 nucleus is also going to send signals to the left cranial nerve 3 nucleus. Okay, and then this is how cranial nerve 3 becomes activated, and where it's going to end up causing contraction of the medial rectus of the left eye. So now both eyes are going to look to the right. So MLF, which stands for medial longitudinal fasciculus, is right here. Okay, so in the case of Mlf syndrome, this pathway does not work properly, and since this pathway does not work properly, our left cranial nerve 3 nucleus does not get activated. Therefore, cranial nerve 3 itself does not get activated, and our medial rectus of the affected eye, which in this case is the left eye, does not contract, and the left eye remains in the center. So the patient's eye is going to look something like this. As you can see, the patient's right eye is looking to the right, but the left eye does not follow. The right eye is the unaffected eye, and the left eye was the affected eye. Okay, so the affected eye remains in the center and does not move. Another thing you need to look for is nystagmus in the right eye as well, because if you think about it, the right eye has moved, but since the left eye doesn't follow it, it gets kind of confused. Doesn't know whether to stay or go back. So it's going to have nystagmus. Now, another high yield information that you must know about MLF is that in patients with MLF, convergence is going to be normal. Okay, so they have normal convergence, meaning that they can look medially with both eyes without a problem. So something like this. Okay, they can look medially without a problem. And the reason for this is because they are getting information directly from the cortex into the cranial nerve 3 nucleus on both sides. So the cortex is going to send signals directly to the cranial nerve 3 nucleus on both eyes, on the left and the right, which we didn't draw. So that's why there's no MLF involvement, and they can converge both eyes medially. And another high yield information that you need to know, and I'm pretty sure you guys all know, is that this syndrome is associated with multiple sclerosis, which is an autoimmune disease that will attack the MLF. So this is it, guys. Try to watch this a couple of times, draw it for yourself, try to explain it to yourself or your colleagues or whoever is available in order to really understand it. Because once you really understand this disease, there's not one single question that they can turn or twist that you'll not be able to answer. With that said, good luck on your exam.